Sadiq Adedeji is on the road to recovery and home. Adedeji is from Nigeria, and that's where this story begins. About a month ago, a CAT scan found that he had a large mass in his abdomen. That's when Adedeji and his wife got busy.
We got the CT scan and sent it around to family members and friends, trying to look at where we could get the best clinic.
They sent the CAT scan to his sister-in-law, who's a doctor in Australia, as well as other family members in England who are also doctors. But it was a friend in Natchitoches who was a doctor who answered Adedeji's email. He told him about Dr. Quyen Chu, the chief of surgical oncology for LSU Health Sciences Center in Shreveport.
I read through his profile and I just told myself, well, this is the man.
Dr. Chu was sent the CAT scan and began reviewing it.
Obviously, when I looked at the CAT scan, you always worry about adjacent organs, also major vessels, that if you're not careful about, you could really end up hurting the patient more than help.
Shortly after being diagnosed, Adedeji and his family hopped a plane to begin the 6,600-mile trek that would take them from Nigeria to University Health in Shreveport. Adedeji didn't want to waste any time. After his initial meeting with Dr. Chu, Adedeji was ready for surgery.
5th of May 2015 is a turnaround point for me.
Dr. Chu and his team spent 5.5 hours removing the tumor.
We took out the whole thing as well as adjacent organs that appeared to be stuck to it. So in other words, we did take out the spleen, the colon, and part of the stomach, and then we had to hook them back up all together again.
The mass that Sadiq Adedeji had dealt with for months weighed nearly 10 pounds. Looking back, Adedeji says there were signs of a problem: bloating, acid reflux, constipation. But it wasn't until he began having issues eating solid foods that the mass was discovered. And little did Sadiq Adedeji know that in just 6 weeks, an email would help him find the medical help he needed, half a world away at University Health in Shreveport.
If anybody tells me I was carrying a 4-kilogram mass within me, I would have said it was a lie.
But when he returns to Nigeria, he'll continue treatment to make sure the tumor doesn't reoccur. For the University Health News Network, I'm Ed Walsh.